Hello, everyone, and welcome to Well Within Reach. I am extremely honored today to have Dr. Serge Jabbour, who is the director of the Division of Endocrinology, Diabetes, and Metabolic Diseases. He is also a professor of medicine at the Sidney Kimmel Medical College at Thomas Jefferson University. But I got to say this, I've been knowing Dr. Jabbour a very long time. And I don't know if I've ever told him this, but I think he's probably one of the best endocrinologists I've ever had an opportunity to work with. He's taught all of us so much over the years. Every time he speaks, we learn something new. He runs a phenomenal endocrinology program at Jefferson, the clinic, his patients, everybody loves him. So to have him with me today, I can't tell you how excited I am and how appreciative I am. So Dr. Jabbour, the floor is yours. Tell us about all of the things that you all are doing down at Jefferson.
Well, first I have to say, Neva, I'm so happy to be with you today. I'm really excited, and I'm really touched by your nice introduction. Thank you very much. I've been at Jefferson, in fact, for a long time. I did my fellowship training in endocrine and diabetes at Jefferson in 1997. I finished in 1999 and stayed at Jefferson. So that's how long I've been there at Jefferson. And now I had the endocrine division since 2006, in fact. So I have in my division a total of 13 providers between physicians and nurse practitioners and diabetes educators and also dietitians. And, we see all kinds of endocrine disorders, but obviously we focus more on diabetes and weight management. I see patients probably 2/3 of the time, and then the other third is focused on research. So I run the Diabetes Research Center where we do clinical trials from phase 1 to phase 4. So we study all the drugs you see now on the market. In fact, we studied them a long time ago to see how they work and what's the safety of each drug. So we do these trials to try to help sponsors, which are companies or the NIH, to come up with new drugs to treat diabetes and manage also weight. And of course, because we work at Jefferson, which has a medical school, we teach medical students who rotate with us. We teach house staff, interns, and residents. And, we do some inpatient work, obviously, to see consults also in the hospital, which focus mostly on diabetes management.
Wow, that's a lot. So today, Dr. Jabbour, I want to talk about probably what everybody's talking about. It's everywhere. People are asking us about it. Is the glucagon-like peptide 1, which better known as the GLP-1. So tell us a little bit about what you're hearing, what you're doing in the area of this. I'm not going to say a medical breakthrough because it's been around for quite a long time.
Yeah, sure. In fact, I could talk for hours, Neva, but I'll try to shorten that and give you my maybe 2-minute summary. In fact, the GLP-1's been on the market since May of 2005. That's when the first GLP-1 came out. Of course, at that time, it was given as a twice-a-day injection. Then years later, we had the once-a-day injection, and then years later, the once-a-week. We have now a bunch of once-a-week injections. And we also had recently the oral pill you can use on a daily basis. Now, the GLP-1s are great because they have many benefits. So they are used for diabetes management, obviously. They can lower blood sugars and A1C. As you all know, A1C is the 3-month average of all the blood sugars. And that's the endpoint. That's the kind of main blood test we look at to see if someone is well controlled from diabetes standpoint. So the GLP-1s would lower the A1C. They will help also people lose weight through suppressing appetite. And that's why some of them are approved for weight management and some are approved for diabetes management. Now, I know it can be confusing, but some of the GLP-1s may have the approval for both, but they have two different names. I will not mention, brand
Mhm.
names in this talk, but you can have the same drug and it might have a name when it comes to diabetes management and a different name for weight management. But also we have shown in the many studies we have done that these drugs can lower the risk of heart attack, stroke, and they have also a kidney protective effect. So patients on these drugs will end up with better kidney function over time, and the risk of ending up on dialysis is much lower. They're also great for patients who have heart failure. They would improve the cardiac function. So patients who have heart failure would see improvement in their symptoms and end up less often in the hospital. So they have many benefits, but they have also risk. I mean, there's a safety which is also linked to it. So again, I don't want to spend too much time,
Mhm.
but initially,
Mhm.
when you start the GLP-1, you may have GI side effects, which can occur in around 30% of the time. Patients may complain of some nausea, vomiting, diarrhea, constipation, abdominal pain. The good thing is, most of the time, these are mild, transient side effects. They will go away once the body adapts to it. But there are people who end up stopping the drug, obviously, because of these severe side effects. And rarely, less than zero point 0.6 to 0.1% of the time, these drugs could lead to acute pancreatitis, gallbladder disease, acute kidney injury from severe dehydration. So there are some rare complications. Also, luckily, these are rare. The more common ones are typically mild, and most patients do well on them over time.
Yeah, thanks for that. One of the questions that we get a lot from some of the folks that come here at the Frazier Family Coalition is if I start a GLP-1, am I going to have to continue it? What happens when I lose the weight, when I get my A1C down? Is this something I've got to do forever?
Yeah, that's a great question, Eva. And we looked at this, in fact, in few studies. So we have
Mm.
some data coming from the trials we have done. And we showed in the trials that no matter what you use the GLP-1 for, is it for diabetes management or is it for weight management, when patients stop the drug at some point, could be a year later, 2, 3 years later, most of the time, the A1C will go up again and weight will come back. So, yes,
Mm.
the answer is when we start these drugs, it's typically for a long time. I'm not going to say lifelong,
Right.
but what I have seen in my practice, because again, remember, the studies look at lots of patients. And again, things with each patient could be different. So we looked in the studies, at that small number of patients who were successful in stopping the drug and they were able to maintain their weight loss and their A1C, which is now at goal. And in real life, I have seen patients who succeed in stopping the drug at some point, the GLP-1, and maintaining their weight and maintaining their A1C at target. So the only difference with those patients who were successful long term is that during the GLP-1 treatment, they've seen the dietitian or the nutritionist
Mm.
and the diabetes educator, and they were able to get better education and also teaching about how to eat healthy, how to exercise, and how to manage your day-to-day, stress. Because remember, when people are stressed out and we can't avoid stress, they tend to go for different foods, maybe stop going to the gym. So when they get better educated on how to eat healthy, what to eat, what time to eat, should I skip one of the meals or not, how to combine proteins and carbs, what are the better carbs, And of course, exercise is key. But the question always is, what kind of exercise? Those are the people who end up being successful. Why? Because in addition to being on the drug, the GLP-1, they've also, undergone lifestyle intervention. So they changed their lifestyle. They were able to understand better how to adjust your diet and also activity level to better suit them. And that's how they became successful over time in weaning off the GLP-1 and maintaining their weight and their A1C at target.
I am so glad that you mentioned, lifestyle changes, because that's something that we want everything to go hand in hand. The final
Yeah.
thing I wanted to ask you about, which is another thing that a lot of people ask about, is insurance coverage. Like,
Yeah.
will my insurance cover this? What is the eligibility for insurance coverage? Could you shed a little light on that for us?
Yeah, so that's a little bit tricky. And,
Mhm.
and the reason I say that, because it depends what you're giving the GLP-1 for. If it's for diabetes management, most of the time insurance coverage is much better than when we give it for weight management. As you may know, many insurance companies would not cover weight loss medications, but they would cover medications to treat diabetes. So if someone is diabetic based on A1C, obviously, then the coverage is much better. It doesn't always work, obviously, because there are some insurance companies which can limit the GLP-1s to a last resort. Because again, and again, have to talk frankly, insurance
Mhm.
companies are business companies. So their interest, yes, there's the patient from one side, but there's also the money from the other side. They don't want to spend too much money on every patient. Otherwise, they might go bankrupt, right? So they try to limit the expenses to the minimum. And that's why they set rules on when the GLP-1s are approved or not, because these are expensive medications. So that's why when it comes to weight management, the coverage is not as good. And there's no rule. Like sometimes patients tell me, what insurance should I get to get better coverage? I'm like, you may get insurance A, but in a year, their coverage is going to change. As you know, each year, each insurance company is going to change what drugs they cover. So you may get lucky for 1 year, but then things can change a year later. So there's no way to know. In real life, when I prescribe a GLP-1 and we send it to the pharmacy, at the pharmacist level, that's how you know if the coverage is happening or not. So the pharmacies will enter the drug in their software, in their computer
Mhm.
software, and that would tell them when they link it to the insurance the patient has, if the coverage is going to happen and what copay, will be at the expense of the patient, obviously. Now, one thing I need to mention here, which is really important, as of July 1st, the government came up with a program called the Bridge program, which allows Medicare, so only Medicare patients, to be on any GLP-1 for weight loss. And
Mm.
that could be either the once a week injection or the daily pill, if they fulfill certain criteria, for only $50 a month.
Okay.
Now, again, the criteria are a little bit too long to mention here, but I'll give you an
Mhm.
example. So, someone who has a BMI or body mass index of 27 and higher and pre-diabetes would fit the criteria and will get the GLP-1 for $50 a month, but they need to have Medicare, obviously. Or, for example, if they have a body mass index of 35 and higher, even with nothing else, then they will fit the criteria. Two, if they have a body mass index of 30 and higher, but they have heart disease, then again, they will get the weight loss drug, the GLP-1, for only $50 a month. So that applies for weight management, because the government felt that it's very important for people to lose weight to prevent many medical conditions. So they're offering that Bridger program, which is now available through December of 2027. But patients who have commercial insurance, the only way to know is through the pharmacy, which will look into the benefits and the coverage of the drug.
All right. Well, Dr. Jabbour, you have really given us a lot of information in a little bit of time. And again, we just appreciate you being here with us. I'm going to give you the final word. Give us a final word for today.
No, thank you very much for allowing me to spend even little time discussing this. I could talk for hours. I love this topic. One thing I say to all my patients, that the GLP-1s are amazing, great drugs. They work for diabetes management, for weight management. They have amazing benefits, but never forget lifestyle intervention. That is really key. In fact, we've had patients through only lifestyle changes succeed in managing their diabetes and losing weight. But I know it's hard. It's not always easy to go through lifestyle intervention. So that's why GLP-1s are really important. But never forget diet changes and following a certain exercise regimen. Those are the basic keys for success when it comes to diabetes and weight management.
Thank you so much. And again, we appreciate you being with us. Take care, Dr. Jabbour.
My pleasure. Thank you.